The third National Lung Cancer Audit report has just been published and has been released at this conference here. And we looked at staffing provision and the provision of treatment diagnostic modalities in England and Wales via a questionnaire survey. Now, this is the third time that we've done it, so we've been looking at changes across times. The first one was 2014, then 2017, and now the last one in 2019. But the difference with this one is that we have guidance to benchmark, and that's the commissioning guidance which was published against the National Optimal Lung Cancer Pathway. Sort of key highlights from the report show that only 5% of trusts meet the staffing recommendations in the National Commissioning Guidelines, and only about 2/3 of trusts are meeting the 10-day turnaround for molecular testing. So 2/3 of trusts don't meet the 3-day turnaround for pathological subtyping, and about 60% of trusts don't meet the 10-day turnaround for molecular subtyping. And about a half of trusts don't have a policy for tobacco addiction, which is obviously significant. And again, 2/3 of trusts have a dedicated member for data input from the MDT, but only 18% actually have time in their job plan to do that. So those are the key highlights from this year's third organisational audit. Now, it does highlight that there is deficiencies in care across the country, and also the gap in trying to meet the National Commissioning Guidance and therefore meeting the National Optimal Lung Cancer Pathway, and how ambitious that is. And hopefully with these results it will empower trusts locally and regionally to put pressure on managers to campaign for more resources. But beyond that, I think it calls for national action to address these deficiencies in care, because I think there's no more exciting time in lung cancer than now, with all these emergence of new therapies and new treatments and diagnostics. But I think that the majority of patients won't actually benefit from these if we don't address these deficiencies in care.